Neotown 938 Live Facebook page. That's official 938 Live.
The news when it happens on 938 Live.
The LTA traffic news on 938 Live.
6255-8400 is Traffic Watch's hotline. We have reports of faulty traffic lights on Jalan Buroh at the junction of Pioneer Road and Tanjong Kling. Also, vehicle breakdown on the BKE to Woodlands after the KJE exit. Reports coming in of a breakdown as well on the BKE to Woodlands after Mandai Road exit. Heavy on the KPE towards TPE at TPE's SLE exit, and heavy on the PIE to Changi at Jalan Eunos exit.
Here's a message from the LTA.
Please drive carefully when approaching work zones. Look out for orange-colored work zone signage and cones. Follow the latest traffic news on Twitter at LTA Traffic News.
938 Live gets you talking.
You're with Body and Soul. It takes more than just an apple a day to keep the doctor away. Shape up with Body and Soul.
We're back on Body and Soul on 938 Live. A recent case of a woman who's found to have had 27 contact lenses lost in her eye. She lost them over the years, and it turned up during a routine cataract surgery. They abandoned the cataract surgery and removed these lenses. Dr. Lee Sao-ping joining us, a specialist at Shinagawa Eye Center. You'll, of course, have read about how that's not terribly uncommon. Well, it probably is very uncommon to have 27. But it's not uncommon to lose lenses in your eye and to need medical help and assistance in order to try and remove this. Has this happened to you? Fallen asleep, can't figure out if you've taken your lenses out or not? And also, what's the harm if it does start moving around in there? What kind of harm are you putting yourself at risk for? You can join in at 669-11938. Dr. Lee Sao-ping's an eye specialist at Shinagawa Eye Center. Let's go to that point, Dr. Lee, which is what kind of damage can happen if this happens to somebody?
Well, if the contact lens is left in the eye for a length of time, especially when it's out of position, it will accumulate mucus and even bacteria. And as it moves on the surface of the eye, it can scratch the eye itself, and it can lead to an infection of the eye.
That's very serious in the sense that, is it just an infection and redness, obviously pain, but can it lead? Everybody's always worried about blindness.
Well, if the infection happens on the cornea, which is the front surface of the eye, and the infection is very severe, then it will heal with a scar. And this scar, when it's thick and is centrally located, then it will definitely block the view. So yes, it can lead to very poor vision when the scar is very huge.
I mean, these lenses are not really supposed to be there as long as this, right? I mean, one would assume if she's had 20, for example, in this woman, 27, over probably years or months maybe, can the contact lens really stay so long? I mean,
which is why this is also unusual to be there for so long and to have so many of them accumulated over the years without any symptom at all is really unusual. She should really feel something in her eye, that some discomfort.
But can the material break down? Can it last so long? I think that's what people.
Oh yeah, it can. It can last long. Yeah, meaning that it won't be broken down by tears. Yeah, so that's why it can stay there for so long. But I mean, without discomfort, that's the unusual part.
Yeah. Absolutely. Let's give our listeners some advice. Let's say this has happened to them. I was just speaking to a coworker yesterday and telling her about the topic I was doing. She's like, that's happened to me. Just suddenly I can feel the lens just shifting to a part of my head. And she just stood in a mirror for a very long time trying to move her eyeball around and around and around to try and get it back into position. Luckily, it did in her case. But if this does happen, if you lose or lodge a lens somewhere, what should you do?
I think the first step is to lubricate the eye. So get hold of some lubricant eye drops, put it in. And then when you mentioned about your friend looking into the mirror, if she can see the lens actually, by blinking and by wetting the eye with a lubricant eye drop, it usually should bring it back in place. So that's when you can still see the lens maybe just slightly off position. Let's say you can't see it at all. You look in the mirror and you really can't find it. Then I think some people would have this tendency to want to pinch on their eye, try and look for it. And I'm going to recommend maybe you try it once or twice and you can't get it. Then it's not there, so don't go on pinching it anymore. Definitely put lots of lubricant and blink a bit more and see whether it can come back into position. If it cannot, and if you really feel that there's discomfort in the eye, then definitely please go and see an eye doctor.
Because the more you're pinching away, you could be damaging.
You can damage your eye. Yes.
And I guess the lubrication, yes, that helps. Hopefully, help it move back into position. That's a good point, though. I mean, in terms of lubrication, some people will get that kind of like medicated eye drops or the preservatives one. I mean, does this matter? Some are more viscous than others, for example.
In this case, because it's just going to move the contact lens from one point to another, they just use a normal, not viscous, definitely not viscous. So something very aqueous, very fluid. To put in the eye, yes. So it doesn't matter whether it's preserved or preservative-free. Just get hold of what you have and try to shift it with the fluid in the eye.
But don't use water. Don't rush to the bathroom.
Oh, yeah. Please don't use tap water, definitely.
Yeah, because I think that's the first thing that a lot of people might try. Rush to the bathroom.
Yeah.
Let's say if it happens in the office, then straight away just throw water in the eye. That's bacteria. It's very dry. It's not going to work.
Tap water in Singapore is very clean, but even when it's clean, it still does not mimic the tears that we have in our eyes, and it's certainly not sterile, meaning it can still contain bacteria. So better to use sterile lubricant eye drops.
If I really can't find it, should I go see my doctor or the A&E?
Oh yeah, definitely. If you feel this is uncomfortable or you really think the lens is inside there but you can't find it, then definitely go and see an eye doctor or go to the A&E.
And then we can hopefully avail ourselves of some of the techniques that you described earlier on, for example. Mm-hmm. What would we be talking about in terms of a different kind of lens? RGP, the rigid gas permeable lenses. Would it be less likely to happen if somebody used those kinds of lenses?
I think it can still dislodge, but less likely so. And also, if it dislodges, usually it will be really quite uncomfortable because RGP lenses, they are rigid, they can't fold. So when they're out of position, it may nudge on the eye in a certain direction, in a certain way that the person will feel it's uncomfortable. So they definitely will know when it's out of position.
Yeah, it's thick. It feels thicker, definitely. That's what a lot of people say. But this brings up a good point. I'm glad. I mean, obviously, this is a very rare occurrence. It's very shocking. It's quite out of the ordinary. But at the same time, it gives us the opportunity to talk about the importance of contact lens usage and the hygiene associated with it. I want to spend some time talking about that, Dr. Lee. What do we need to, because it's been well documented and well talked about that the long-term contact lens users are putting themselves at risk for other problems happening, not just losing your contact lens, but also damage to the eye potentially.
You're right. The more a person wears his lenses, that means more hours each day for many more years compared to other people, then their eyes will progressively get drier. As it gets dry, then of course the eye is very uncomfortable, and it can lead to unusual, abnormal blood vessels that grow in from the side of the cornea. And as it grows in, it can bring on a scar tissue as well. So meaning not only does it get dry, it can damage your cornea and it can reduce the vision of the eye. Also, some people get allergies with the lens wear, and over time, this can also harm the eye. Some people, the lenses can cut on the eye, so it leads to abrasions, scratches. And with abrasions, sometimes it can then lead to infection. And we spoke about infection earlier. It can lead to very bad vision if it's a severe infection.
And a lot of this is coming out, like you said, from long-term usage or long hours, and also, I guess, poor hygiene associated with how people handle and utilize these contact lenses.
Yeah, actually, if they go to an eye care professional, meaning to any optical store to buy the lenses, they will be taught good practice, good habits of lens wear. So meaning, for example, they'll be told to wear it only up to a certain number of hours each day. Don't overwear. Don't sleep with the lenses on. Never wash your lens with tap water. Some people even clean it with saliva. That's a no-no.
No.
So there are a few things that they need to follow.
Yeah,
so
we
don't
have to
overwear, and when it's dry, when it's uncomfortable, put lubricant eye drops. And if that doesn't work, if they're still uncomfortable, then definitely stop wearing the lenses for a length of time until they start feeling better.
But a lot of people would probably say, like, but I need them. I need to see, and I don't want to wear my glasses anymore. I guess the alternative for a lot of people when they try and stop, I know many people who got repeated infections, and that's why they go for corrective eye surgery, for example, or they want to minimize the risk of developing some of these issues, or maybe sometimes they just want to be done with the hassle of using contact lenses. I'm sure you've looked into the eyes of many patients who come in who want to do corrective surgery, and you've seen the remnants of the damage that's been done by contact lens usage. Are they? Are you viable still for corrective surgery if you've had a long-term usage of lenses?
So a lot of it depends on how severe, how extensive that damage is. So if it's still just dryness, then dryness can be controlled with lubricant eye drops, treated well, and once the dryness goes away, then they can have the corrective surgery done. However, if there's been repeated infections, for example, then it will leave scars on the cornea. So if this scar is centrally located and is thick, then this person is not a suitable candidate for the corrective surgery. So it really depends on the situation. Yeah, so actually it's a good idea to always take good care when you wear lenses. When it's dry, stop wearing for a while, lubricate it well. When you don't feel well, go and see an eye doctor or your optometrist and find out why. Why is it that the eyes are not feeling good? And so once you take good care of it, usually the eyes will be fine.
Absolutely great advice, Dr. Lee. Thank you so much. I realized I left out one point very quickly because I've got not much time left. If you've lost that lens in your eye, I know a lot of people